Okay, hello. Welcome everyone to the fourth London Sport and Mayor of London Talking COVID-19 and Sport. This is the fourth in a series of fortnightly webinars delivered by London Sport in partnership with the community sport team at the Mayor of London's office, designed to help London's community sports sector address some of the challenges that are being experienced as a result of the COVID-19 lockdown measures. I'm Lauren Kosher. I'm the Senior Programme Delivery Manager within the Community Sport team at the Mayor of London's office. As the chair of today's webinar, I'd like to share some housekeeping notes with you. Everyone's all on mute at the moment, which is great, thank you. So if you could all keep your microphones on mute and make sure your videos are turned off, just because we have a lot of people on the call, so this will help with sound quality and minimise any distractions. We will be recording the session as well to send it out to a wider audience. So firstly, as an introduction, Talking COVID-19 and Sport is an initiative that's been developed in response to the current crisis to address the biggest issues facing London's physical activity and community sport sector at this time, and to offer practical advice. Each webinar will be led by a representative from the Mayor of London's community sport team and a representative from London Sports. And for each webinar, we will also bring in external industry expertise to provide wider insight on the topic. We'll be delivering all of these webinars through Zoom. However, we are of course conscious of the accessibility challenges that webinars present, and the post-session recording will be fully subtitled. So in today's webinar, we will be exploring mental health during lockdown. In public mental health terms, the main psychological impact to date is elevated rates of stress or anxiety. But obviously, as new measures and impacts of this crisis are introduced, levels of loneliness, depression, harmful alcohol and drug use, and self-harm or suicidal behaviour are also expected to rise. As our speakers will explain, this is not just a priority because of COVID-19, but the crisis has highlighted mental health concerns and in turn how people are turning to sport and physical activity for their mental health. So the purpose of this webinar is to provide you with a broad overview of mental health and physical activity initiatives, campaigns and resources during the COVID-19 lockdown. Barry, if you could just go to slide 3. Yeah, thank you. So to deliver this topic, you'll see that I'm joined by 3 speakers. Our first speaker will be Barry Kelly, who is Specialist Advisor for Physical Activity for Health at London Sport. He has over 20 years experience in the health sector and has an expertise in a range of areas, including health inequalities, the wider determinants of health, physical activity, and other lifestyle related issues. He'll be presenting a broad overview of mental health and physical activity initiatives, campaigns and resources during the lockdown. We're also joined by Bevis Allen, who is Boxing Development Officer at London Sport. Bevis currently supports Camden, Lewisham, Westminster councils and in England boxing. He has supported numerous organisations and boxing clubs to deliver various projects ranging from women and girls, faith groups, knife crime, young men in custody and mental health, to name a few. He will give a quick run through of the work that's been going on around boxing on this theme. And finally, Carla Burton, who is Physical Activity Officer at Mind and is our industry specialist this week. So Carla is the regional support lead for 9 networks across the UK that bring together sport, physical activity and mental health organisations to share best practice, network, upskilling opportunities and to support more people with mental health to be active. And Carla will be providing a brief overview of Mind's work supporting mental health at this time. So thank you all for joining us. So next slide, please. Can we just go to the next slide, Barry? Thank you. Okay, so in terms of the running order, so the first half of the webinar we'll hear from our speakers. Firstly, Barry, then Bevis and Carla. And the second half of the webinar will be for the Q&A. There's a lot of people on the call today, so we request that you submit your questions in the public comments section. So you can either send it publicly or privately to myself or to my colleague Paulina, and I will then pose the questions to the speakers during the Q&A. You can start submitting your questions throughout the presentation, and we have also received some questions in advance. So let's get started. So I'd like to hand over first to Barry.
Thank you for that, Lauren, and sorry about the slow response in turning the slides over, but I was pushing the button as fast as I could. Yeah, good afternoon, everyone, and thanks for joining the session. I was asked to provide some context for the discussion this afternoon, and I think the first thing to highlight, as Laura mentioned, is that mental health was certainly already a priority within London prior to the Covid-19 pandemic. Mental health features prominently in the Mayor of London Health Inequality Strategy and also the Health and Care Vision for London. But I think it's safe to assume that the impact of Covid-19 will throw up some new challenges, some of which we will not really fully understand or even quantify until this evidence develops. So it probably makes sense to start by highlighting some of the key numbers and stats which I've taken from the Mayor's Health and Equality Strategy on this next slide. So just to run through each one, 1 in 4 people in the UK will experience a mental health problem each year. Suicide is the cause of death of 12 Londoners every week. Just a quarter of people with mental health issues receive treatment compared to 3/4 of people with heart disease. People with a serious mental illness are 3 times more likely to die prematurely than the general population. In London, nearly 10% of children aged between 5 and 16 have some form of mental health condition. And people in low-income households are 2 to 3 times more likely to develop mental health problems than those in the highest income households. And just to pick up on that point about household income being a key determinant of mental health, it is clear from the evidence that mental health has a significant inequalities dimension to it, hence the reason that it features in the inequality strategy. So I also just wanted to pick out a few quotes from that strategy that help explain that a bit further. So there's 2 quotes. The first one at the top: poor mental health is both a consequence of inequality and disadvantage and a cause of it. Some communities and groups of Londoners who face these inequalities also carry a higher burden of mental health than others. This includes people living in poverty, people in poor quality jobs or unemployed, or those who have been homeless. And importantly, people with long-term physical health conditions or disabilities have a higher risk of poor mental health. I think the inequalities aspect is a really important point as it really shapes the types of population that we look to work with. Consider where those populations live and work and where interactions take place with those populations on a daily basis. And having just given you a sneak preview of the next slide, just moving on to that one, I thought it was also worth mentioning the Marmot Review 10 Years On, which was published in February this year, and to be honest, didn't actually receive a lot of coverage. The report looks at the current state of inequalities in the UK and is pretty damning on the progress made since the initial report of 2010. It highlights the impacts of austerity, it talks about ignored communities and a widening inequalities gap, which is impacting disproportionately on specific groups, which obviously is very important to us. Importantly as well, this was also before Covid-19, but highlights that the sort of baseline or starting point pre-pandemic was already a sort of great concern. And all of this can have a significant impact on mental health. So moving on to the next slide, which hopefully starts to sound a bit more positive. We know that physical activity has a role to play in helping contribute to addressing aspects of inequalities and improving mental health. These benefits are highlighted in the Sport England infographic on this slide. As we can see, the benefits of physical activity range from improving self-esteem and confidence, reducing risk of depression, to employability and reducing social isolation, all factors that we know can directly impact upon people's mental health. So in terms of the impact of COVID-19, it's obviously too early to say the full extent of what that impact will be, but the next few slides, I suppose, cover some of what we already know, or what we're starting to find out, sorry. So the first point to mention is that Public Health England, in collaboration with the Local Government Association, Association of Directors of Public Health, NHS England and NHS Improvement, have published guidance on the potential impacts of COVID-19, as well as suggested actions to mitigate against those impacts. and all that guidance is based on the sort of best available evidence to hand. There is specific advice for people with mental health problems or recovering from mental health problems, or for people with serious mental illness. Interestingly, the guidance suggests that prolonged periods of social isolation and social distancing are likely to impact on the mental health and well-being of vulnerable groups in general, as well as those who have already mental health conditions, ranging from anxiety to depression to more severe conditions. And I suppose of interest to us, physical activity has been identified to support a number of these vulnerable groups, including older people, children, young people, those shielding and self-isolating with a long-term condition, early years, and people with an existing condition itself. So some of the examples of what physical activity is suggested: promote home-based physical activity, including activity appropriate for different groups. Example, those with more limited mobility, those at risk of falls, more active but vulnerable, and including promoting safe outdoor time, for example, in people's own gardens if they do in fact have access to that. Secondly, promote physical activity to help structure the day and manage stress. And thirdly, target resources for physical activity to the needs of the most vulnerable, older people, including those who are at risk of falls, to keep muscles, bones and joints strong, which obviously again is an important sort of risk group for us. I suppose the second thing to mention is that Sport England produced a COVID-19 insight briefing, and that highlights some of the trends that are happening across the course of the sort of weeks that we've been in lockdown. And that is still highlighting that there's inequalities in terms of how active people are. And there's a sort of variations across BAME groups, people with disabilities, and specific age groups as well. I suppose that the final point to make is that I suppose as the evidence develops, the advice will evolve, but early indications from the research and data suggest that mental health issues and health inequalities will be exacerbated by COVID-19. So the ongoing response from the physical activity and sports sector will be crucial in helping address this. And just to finish with, I just pulled together some resources that certainly we've been accessing to help us understand this area a bit more during this time. London Sport and Sport England, and then to mention another few, the Mental Health Foundation, the Local Government Association, Public Health England, Every Mind Matters, Mind, which obviously Carla will pick up shortly, the Mayor of London, and Thrive London. So those are some useful resources to tap in to find out sort of what's happening with the sort of latest research and evidence as we find out more. But I suppose that's the sort of end of my sort of part of the presentation, and I'm happy to hand back to Lauren.
Great, thank you, Barry. And just to let everyone know, the resources that Barry just mentioned will be in the post-webinar communications that we send out in the next few days. So I'd like to hand over now to Bevis to give us a bit of an overview of the boxing approach in this period of time.
Thanks a lot, Lauren. I'm going to talk for 5 minutes about boxing's approach, namely the national governing body, England Boxing. Back in February 2019, we'd developed a mental health first aid interactive workshop. It's a 3-hour workshop with Mind, and the view there was to roll this out across every single boxing club in the country. There's currently about 980, 990. And to date, we've delivered probably about 20 up and down the country. And obviously, then we had COVID-19 and the lockdown, so we haven't been able to deliver any more. So myself, Lynette Mayo, who's the lead on Boxing Mind for England Boxing, and Matthew Williams, who was the co-author for the Boxing Mind workshop, we came together quite recently, and we did a little promo video, and we came up with a Boxing Mind bite size, So the full workshop's for 3 hours. We're going to do a shortened version, which is about 30 minutes. And we tailor this to boxing clubs, boxers, volunteers, coaches, anyone within the boxing community. It's going to be just a 30-minute taster. If they enjoy it, and we've had quite a lot of positive feedback about it so far, we then signpost them to the broader 3-hour workshop once we get back together. Just to kind of say as well, we currently have something like 9 or 10 deliverers up and down the country, myself and Michael Hunter, one of the guys working in boxing. We deliver the courses in London. And just in the same way that every sports club has a safeguarding lead, we're looking to deliver this workshop in every single club so that there's a mental health champion, for want of a better word, in each of the boxing clubs who can deliver this workshop. So we can also have somebody who is maybe not a specialist, but certainly someone knows what signs to look out for and how to signpost anyone who's suffering with poor mental health to the appropriate organisations to offer them full support. That's me in about 4 minutes.
Great, thank you, Bevis. Well done for sticking to time perfectly. So I will pass over now to Carla, who's going to talk about Mind's approach.
Brilliant, thank you. Hope you can hear me. Oh, good. So yeah, good afternoon, everyone. I hope everyone is well and the weather is good in London and surrounding areas as it is in Leeds. So just a fact to begin with, that at least 50% of people are experiencing some kind of mental health at the moment. And at Mind, we've been working hard to provide support to as many people as we can reach during these difficult times through our partners, including the sports sector and our local Mind network. Last week, we closed our adult and children and young people's coronavirus survey, and we'll be sharing the results in the next few weeks. But just to note that 17,000 people responded, and what we do know at the moment is that those with mental health are less active at this time, and this is a real concern. So to provide a quick snapshot of the key things that we've developed over the last 12 weeks to support organisations and people during COVID-19. We are currently administrating the £5 million Coronavirus Mental Health Fund provided by the Department of Social Care to support organisations who provide mental health related services and need to provide rapid response to those who really need it as a result of COVID-19. We've also provided funding to local minds so they're able to move their services remotely and keep up the rapid response needed. As a physical activity team, we've provided an online and offline resources for the sports sector and the wider audience. And we've also developed a coronavirus and mental health toolkit, which includes practical advice for staying at home, taking care of your mental health and well-being, supporting for work, benefits and housing, and a checklist for staying at home. All these can be found on the Mind coronavirus webpage. Specific to the sports sector, we have also been hosting Wellbeing Webinars in partnership with Active Partnerships, SimSpa and Sport and Recreation Alliance, all which really include tips on self-care and the 5 ways to well-being, which are really relevant right now. All webinars have been recorded and available on their websites, which I'm happy to circulate after the webinar. We've also created a Get Active webpage and some offline resources, such as Get Active Bingo, Runners Bingo, and an A to Z of tried and trusted activities. As we understand, we need to ensure that we reach out to those who are shielding and do not have access to online resources. Therefore, we have been working with local minds and partners to support the delivery of these resources through the door or passing through your neighbour. And finally, our free e-learning course. So we know that COVID-19 is impacting on the whole nation's mental health. And through our ongoing partnership with Sport England, First for Sport and UK Coaching, we are thrilled to announce that we have made the mental health awareness for sport and physical activity training free until the 31st of August. We should really hope that we'll reach thousands of people and impact on lives of millions. And again, I will share the link after the webinar. If you haven't already signed up, please do take advantage of the free course while it's available. So that's all from me. I think I kept that very short and concise, but if you do have any questions after the webinar, please do feel free to contact me.
Great, thank you, Carla. So that's the presentation part over. We're just going to close the PowerPoint so you can see all our lovely faces. Okay, so Bevis and Barry, if you could just put your videos on as well. So I'm going to go to the questions now. We've had a few in advance, but also just a reminder, please do send your questions through on the chat, either to myself publicly or just to my colleague, sorry, Paulina. So the first question is from Hilary. I'm going to direct this to Carla to begin with, but obviously Bevis and Barry, please do jump in once Carla's had a chance to answer. So her question is a really interesting one. How important is it now to differentiate between general mental health challenges caused or exacerbated by COVID and specific clinical mental health conditions, and what can or should be done differently to approach support for sufferers in a more targeted way?
It's a very, very good question, actually.
Good question.
I think at the moment, I mean, in terms of like clinical mental health conditions, those, you know, they should be still getting support from our online facilities through our local minds. I agree with myself. I mean, my mental health has declined because of the COVID, not being able to do your usual routine, not being able to get out and about and see your family, and it's really important. I think the difference is that we just make sure that we're keeping connected with people, that we are supporting people in terms of helping them keep routine or mention the 5 ways of well-being. I think that the only difference is that we make sure that people are still self-referring. So there is an NHS sign up that is free, so people can self-refer into that service at the moment. But linking into your local mind or just talking to a neighbour or a family member, I think, yeah, there isn't much difference. It is obviously all about mental health and make sure that we maintain and that we keep in contact and that it is okay not to be okay. But yeah, I think, yeah, we're obviously trying to, what we are aware is that services are really impacted by the current situation and that waiting lists might be longer. So trying to use things today that we're all good at is using the power of physical activity to kind of try and maintain that. But hopefully that answers some of the question.
Bevis and Barry, do you have anything you'd like to add?
I think just to add, I think it does highlight one of the challenges in terms of the sort of variation of sort of mental health issues more generally. And so, for example, someone with a mental health issue might also have another long-term condition and might be shielding at the moment. So obviously that presents its own challenges. So I think that's one of the kind of key elements to a lot of this. It often needs to be tailored to sort of match the needs of the sort of individuals involved. Although I have seen some suggestions around ensuring that people that are already connected to a mental health service ensure that they keep connected in some form. That might be telephone or some other means, but I think that in itself highlights some of the sort of challenges that we are facing, and we're only one small aspect of that from the physical activity perspective. Clearly, there's a whole host of other things going on in people's lives at the moment that it's very complex. So yeah, I think that is the essence of it. But from the stuff that I've seen, it's about trying to maintain those links with services if you're already in them.
Yeah, definitely. Anything further, Bevis?
Yeah, I mean, yes, I'd agree with what both Barry and Carla said. But perhaps just to add is that kind of makes it more important to at least have some idea of where to signpost people, because obviously some people need that more specialist support. Some people may just need to have a chat over a coffee on a Zoom call, and that might meet their needs. But obviously, you know, it's a good question, because if people have long-standing mental health issues, that's probably not going to do it for them. But for some other people, if it's caused directly from lockdown, not to be able to see their family, friends, and a lighter touch might be what's needed.
Just to pick up on what you just said, Bevis, in terms of knowing where to signpost people to. So obviously we had all those links on Barry on your presentation. Is there anywhere else in particular that people should be thinking about signposting to?
It wasn't on the slide I presented, but in our mini bite-sized workshop, we have 2 or 3 slides which has different support networks, Samaritans, Mind, and different local organisations, and it's also on our England Boxing website of where to signpost people should they need to either self-refer or refer a friend or family member.
Great. Okay, thank you. So the next question is a very specific question for Carla. What is Runner's Bingo?
Thank you. Yeah, so Runner's Bingo is one of the offline resources that we've created to kind of encourage people that may have not ever done running. So for myself, I've never done running before the lockdown, but it's one of the only reasons I can get out of the house at the moment. So it's an online fact sheet that kind of gives you a bit of a motivational boost to different kind of runs that you could go on. So some days include stretches, some kind of say take a sweaty selfie, sometimes like try and run a 5k or as far as you can possibly go. So yeah, it's just kind of getting yourself into a routine and trying ticking off an achievement every day.
Okay. It's a great idea, something I need. Actually someone has also just posted the mental health first aid resources in the chat as well, which I can vouch for. They are very, very useful if you've not had much experience in mental health before as well. So if you want to have a look at more. So the next question is for Bevis. Have you seen an increase in boxing clubs contacting you for support with the mental health of their boxers?
Yes. 2 clubs in particular got in touch quite recently, where they've said a lot of the young people who are going to the gym 4 or 5 times a week haven't been out of their bedroom for 7-8 weeks, you know, playing PlayStation, it turns out whatever, and they're quite concerned. And kind of the recurring theme at the moment is, when can we get back to doing boxing? But obviously, being a combat sport, it's going to be one of the last types of sports to kind of get back, and this kind of helped preempt this bite-size half-hour workshop that we just set up. Also, what we're doing is in some of the regions they've set up like coffee mornings, so people can just get on a Zoom call for 30 minutes and just talk about anything, as long as it's not boxing. Which they've proved quite popular. I know down in the Western Counties they've run 3 in the past week, also up in Sheffield and the northeast of England. I'm going to hopefully be introducing some in London as well. So to answer the question, yes, there has been a big increase, and we are trying to do what we can.
Great, thank you. So the next question is, I will probably actually direct this to you again, Bevis, sorry. But obviously, Carla and Barry, please do jump in. What is the way forward for organisations with a mainly group activity focus in terms of resuming some sort of normal level of service? So getting back to one-to-one will likely have a more easier transition, but the rest who rely on the social aspects to positively affect mental health may take longer. And the worry there is that they will lose engagement with more people as time passes.
Well, what I actually think may happen is that some people may end up switching sports and actually doing different sports. At the moment, golf's incredibly popular because you can social distance, tennis. Now we can kind of go outside and do kind of one-to-ones. But even in individual sports like boxing, the whole kind of group camaraderie is what makes the sport, as well as the actual competition side of it. And I think what we're going to find going forward is that where you'd have 50, 60 people in a boxing session, you're going to go down to about 10, 15, if you're lucky. So some of that social interaction is going to get lost. But what it might promote is that in smaller groups, people get closer and tighter.
Yeah. Any thoughts, Barry and Carla, about group activities?
Yeah, I mean, it's obviously hugely challenging. I mean, I suppose the obvious answer is that we need to really defer until sort of a government advice on it's a bit clearer in terms of what the sort of next stages out of this are. I suppose, fortunately for some sports at the moment, they've been given license to resume within sort of certain restrictions, but others are much more challenging. And clearly, if you look at sort of the leisure industry, gyms and fitness centres as an example, obviously for them to sort of resume is much more challenging. I know some colleagues have been sort of in discussions around sort of what that might look like, but that's very early stage. And I suppose just keep an eye and certainly in our Covid-19 webpage for anything that sort of emerges around that. But yeah, I would probably be sort of jumping the gun and if I say anything in particular, but I think just wait on the advice coming out to see how we interpret that as much as anything.
Yeah. And any other thoughts, Carla?
I think I would just say that make sure that you're maintaining your interaction with the people that are part of the clubs. I know that it's really difficult given that clubs can't run at the moment in the capacity that they were before. For example, my walking netball session that I deliver, we've just kept in contact via Zoom when and where possible. Running quizzes, sending through a few skills. It's just keeping that interaction so when things return to some form of normality, that you've still got that engagement and they're more likely to return, and you're kind of losing that bit of drop off.
Yeah, that makes sense. A slightly different topic, but a really interesting question. So this is was submitted in advance. I manage a team of people and I'm struggling with my own mental health and motivation at the moment. How can I keep them going when I'm feeling like this? So I will direct it to Carla first to put you on the spot. Yeah, it's quite an interesting one.
No problem. Yeah, I think it's really important to look after your own self-care. As much as you might be supporting other staff and other employees, other volunteers, you can let that slide. We have some great resources at Mind, such as the Thriving at Work Toolkit, which really supports looking after your own mental health as well as other staff members. But as I mentioned before, the 5 ways to well-being and actually checking in with yourself and how you're feeling, and using some of them tips to help your own mental health, such as talking to people outside of work, taking a break to enjoy things, even to stop and just look at the outside. It's not the greatest thing because I'm in a flat, I don't have the greatest view, but just having a few breaths and just considering things that you're grateful for, I think that really works and helps to maintain your mental health.
Yeah. Any thoughts on this, Bevis?
Yeah, I just reiterate that in that you need to kind of look after yourself first, otherwise you won't be in a position to kind of support anybody else. So yeah, I'm a great believer in the 5 ways to well-being. So yeah, I think you have to look after number 1 first in this instance, so you can support other people.
Barry, anything else to add?
Yeah, just a basic point. I suppose the employer might have policies in place that does provide some support around these issues, and it's probably worth trying to sort of flag that up, because whoever's sent the question in obviously might not be alone in this, and that might be something that's prevalent across other aspects of the organisation. So it's probably worth sort of flagging up there in the first instance. But then, as everyone else has said, I think just seeking advice and don't hesitate about also speaking to the GP or a health professional as well.
Yeah, I think that's really important, and just to kind of build on what you just said, a lot of organizations have employee assistance programs, like you said, which have access to mental health support, but also a lot of funders do as well, and can potentially provide support to grantees if that's available to them. So that's worth looking at, and gathering advice and speaking to people. So we've had a lot of questions that are kind of similar. So as we don't have loads of time, we're trying to group them. So thank you, Paulina, for your help with this. So one of them is around engaging new beneficiaries. So a lot of people have talked about this just in general, but engaging new beneficiaries in physical health to support their mental health. And also in particular, how do we engage beneficiaries who don't have access to online tools? So I'm going to direct this to Barry to begin with, if that's okay.
Yeah, sure. Yeah, I mean, I think I'd sort of maybe hinted at this a bit in my presentation. I suppose the thing about looking at where people with mental health issues are in terms of sort of place or services or environments they might be engaging with. So I think the sort of onus is on us to really look at how we sort of engage with people through their sort of daily lives a bit more. Certainly in our own sort of work, we've been looking at, for example, how we engage better with things like social prescribing, obviously accepting that people have a sort of breadth of sort of support needs, but physical activity sits somewhere within that. So I think for us, we're looking at, well, how do we sort of connect with those types of services to ensure that physical activity becomes a sort of normal part of that, or a key component. So with that, we've kind of started doing some training with social prescribing staff themselves to look at how they sort of raise physical activity within those types of interventions. And then I suppose looking at some of the services that are already up and running. So one of the other things we've looked at in recent times has been with improved access to psychological therapy services, obviously treating people with sort of lower level mental health issues, but looking again at how does physical activity sit within that? Is it part of the sort of offer, and how do we go about sort of designing those types of services to, I suppose, try and make sure that physical activity is used both in a sort of prevention and treatment sense. So I think it's probably a combination of all of those. The one other thing I'd probably sort of mention, and this is covered in the local government association, public health, and all those other bodies that issued the guidance, was just around this sort of place-based element of a lot of this, and how we work in places a bit better, because that's where people are. So a huge element of this is how we work with, sort of go into and work with places to sort of help sort of design and develop solutions that responds to the sorts of things that people want to do. So it's hugely varied. I don't know if that's answered the question, but it probably just gives a flavour of some of the things that we've been doing.
Yeah, I think that's really interesting. Do Bevis and Carla, do you have anything you want to add to that?
Just on the physical activity, I think in the last several weeks, boxing's been particularly good in setting up online virtual sessions. Obviously, it's not the same as a real thing. You've got people like Tyson Fury and his wife doing daily workouts and whatever, but it has kind of helped form that kind of community spirit where people can at least get some activity, and it gets the conversation going. I know a number of clubs who have set up these sessions. They also have things like WhatsApp groups where people can actually talk and share. So it's kind of getting that kind of water cooler chat after the individual session, as well as the physical activity. So just touching on the point that Barry mentioned about physical activity being part of the solution, even with an online presence, you can kind of recreate some of that.
Great. And Carla, anything you want to add to that?
Yeah, I very much agree with Barry and Bevis, but just to say the last part of the question is if you think someone like your neighbour or someone around you, if you know they're shielding and they don't have access to the internet, I mean, just print something off that's motivational and good for them and post it through the door. They may not use it, but you know, it might actually make them be a little bit motivated and do something, whether it's in the house or outside.
Yeah, that's a really lovely idea. And actually, I think at the moment everyone is, or a lot of people are becoming more community minded. So how can we support our hyper local community to be more physically active? That's a great way to do it. Okay, so again, kind of a grouping of questions, and this is quite broad, but a lot of the questions were asking about dealing with grief and bereavement. So I think there's sort of two parts to this question. Firstly, how do we, in this period of lockdown, how do we ourselves deal with grief and bereavement? But also secondly, how do we support our participants or our staff to deal with grief and bereavement, which I appreciate is a big question, but I will put it out to you guys. So I'll put that to Carla first. That's okay.
No, still on mute, sorry. No, yeah, I mean, there is a lot of people that will obviously have bereavement at this time, and it's difficult to say what's the best thing, but there is a lot of support out there, particularly with local Minds and Minds offering a bereavement service. So I would say personally, as a family, just to make sure that you're checking in with people and trying to talk and allowing them the opportunity to talk, but also to signpost them through our link, which I'll put in the page now, to access bereavement services and just to access all the support available to you. It is free. Don't think that anything is silly. Just please talk to people, basically.
Yeah. Great. Anything to add, Bevis, Barry?
Yeah, I'd reiterate that. Just talk, really. You know, that could be on texting, on the phone, but just be a lending ear to listen to what people have got to say. I think that's number one thing. Obviously, we've got the different kind of bereavement services, but some people may not necessarily want to access them. So it's important that people have someone who they can actually speak to, just on a one-to-one basis. Yeah.
And Barry, anything to add?
Again, just a sort of small point, I suppose. In some of the sort of conversations I've certainly been involved in and around social prescribing, I know that there's some areas are looking at how they support people that are involved in running those services to sort of, I suppose, be trained or equipped to deal with some of those conversations a bit more. So there is training out there to help people that perhaps normally aren't sort of at the front line of some of this, but are now, to try and support them to deal with that as well. But in terms of the broader point, yeah, I mean, I think Carla's kind of covered it in terms of contacting Mind and obviously some of the other organisations out there that are equipped to deal with that sort of issue.
Yeah, great, thank you. Okay, so we've had a question here about how to help someone who struggles to engage in physical activity because of their poor mental health. So there's a personal part to this question. So this person has a teenage daughter with mental health difficulties who finds it hard to motivate herself to do any kind of physical activity, but they feel that she should engage in it as it would help her motivation. So how do you break that cycle? So I'll put that to Carla first.
With all these questions coming through. Yeah, I think it's difficult. I think because everyone experiences different mental health problems differently, and people experience motivations for physical activity the same. What I would encourage is that, not that I'm a teenager anymore, but the thing that motivated me when I was younger is to be active with my friends. And as much as that isn't possible right now, is to use things like TikTok and Google Hangout to try and join in activities with like-minded people and friends. So if their friends aren't taking part in activity, to find online resources that meet their needs. So by all means, she can turn the camera off, but I would just encourage her to try so many different things, and she will find the thing that is interesting to her, not to assume what people like. But yeah, it's difficult. I mean, if you have no interest in physical activity, it is difficult to kind of promote the benefits of it if you're kind of still developing through life. So I would just say to provide as many opportunities as possible, and if can, link in with friends.
Great, thank you. Bevis, how do you do that with boxing? How do you get people who aren't interested in boxing interested in it?
Slightly more difficult, but we've started running an older adults group. We used to do it obviously in real time back in the day when people used to meet. But for the last 7 weeks in Westminster and Lambeth, we've been running these sessions, and I think last week we had up to 20 over 50s participate in the session, which is the most we've had, which is a phenomenal amount of people. And I would say half of them would not have come to an actual physical session, but because they're at home, because they're in the comfort of their own home, they don't feel as intimidated to do it. And obviously most of them have been referred to by friends. But I also feel that family can play a large and important part in this. During the whole kind of lockdown, what kind of pleased me is seeing how many families actually exercise together, which we didn't see quite before because the parents were working or doing other things. So I think that's another avenue to kind of help people who wouldn't normally do physical activity by hooking up with their families. It might just be even going for a walk.
Yeah, that's a really good point. The amount of families that are doing Joe Wicks every morning is quite impressive. Barry, anything you want to add?
Yeah, I mean, it's a difficult question. I suppose if you look at sort of behaviour change more generally, then it usually comes from the person themselves in terms of finding something that they want to do. And as Bevis mentioned, that might be a non-typical physical activity. It might be walking, it might be something else. So I suppose it's just getting to the root of what someone wants to do, and then sort of creating an environment that allows that to sort of happen, which probably as a parent is, I can imagine, is quite difficult. So maybe that's where, as Carla says, the friends and other aspects of that might be the motivation to get someone to do something. But I suppose the other side of this is if they're experiencing mental health issues, anyway, it's probably getting sort of resolving some of those issues would be the sort of primary concern in some respects as well, and then physical activity might follow from that. So yeah, I would feel awkward commenting on an individual case, but yeah.
Great, thank you. So this question is for Bevis. Do you know any other NGBs, so national governing bodies, if you don't know NGBs, that are doing sport-specific resources for their members, or if the boxing model might be offered out to other NGBs as a model for them to share?
Well, there has been some talk about kind of rolling it out wider. I know, obviously, I think the FA have something, and rugby as well. And I know swimming, I think, have been started early discussions about having something similar. But I think, well, the boxing one, although it's boxing specific, our 30-minute interactive workshop, which is going to be online, also has some resources from Mind, which is not about the sport, which is just about coping with coronavirus. So I think I think it's quite an easy thing to adapt it, because some of it is about the sport, some of it is just about general looking after your mental health and being able to signpost people. So I do think it's something that we can roll out nationally across all sports, really. Great.
Thank you. So actually, just to follow up from that, there's been a lot of questions about resources available. So questions on resources for children, for mindfulness, and for training. So Paulina has put some links in the chat already. So thank you for doing that, Paulina. One of those is the training that you mentioned, Carla, the free mental health awareness for sport and physical activity training. And also there is another one from Thrive London, which is on suicide prevention. But please let us know if there's any others that you would like us to add. But there's a kind of a general question on are the free training offers good enough, or do we need to pay for quality training? So let me see what you think there. So Carla, what do you think?
Yeah, I think like in terms of like mental health awareness and the Thrive London Toolkit, I think it's a great step to developing your knowledge. I think it depends on what capacity you work in. So myself, I've taken a mental health first aid course, which is 2 days, which is really, really, it really upskilled my own knowledge and development and my overall confidence of dealing with those with mental health problems. So I'd say that they are relevant if you want a basic overview, but if you do want to get perhaps more upskilled, then I would look down that kind of route.
Okay. Any other tools and resources, Bevis, Barry, that you would like us to add to the chat that we haven't already mentioned?
Yeah, no, I think most of them were sort of covered in the sort of links that I'd included in the presentation. The only one I would add that I missed was that there's an Active at Home booklet came out from Public Health England. I think it was yesterday, which summarises a lot of the stuff already out there, but it looks a pretty decent resource. So if I could probably add that to the list of things, then that would probably be helpful as well.
Great, thank you. And yeah, I think it's really important to kind of reiterate what Carla said. Like, it's actually amazing that all of this information is available for free at the moment, and people are offering it for free. So make the most of it, use it, and if you do want more, then there are lots of others available that are paid for, but right now this is a fantastic resource, so definitely use it. So another question, or I'll direct this to Barry to begin with. It's on the impact of the return to sport on mental health and the heightened expectations that might come along with that. So basically the question is sort of how do we, I don't know if this is really a question, but it's more of a statement, so I'll turn it into a question. How do we support people who might be overtraining in order to catch up, which then negatively affects their mental health?
Oh, that is a difficult one. I don't, is Bevis, is that something that you would be, sorry to pass the buck?
No,
that's what Barry, I'm used to it now.
Just given your boxing example there of people that obviously are struggling with lockdown and then are thinking about returning to sport, do you know if they would sort of bring in any specific measures to sort of deal with that?
I think it depends. I think obviously at elite level, you've got psychologists and you've got, you know, at GB level, you've got the world and his brother to be able to support. Down at grassroots level, it's slightly more complicated, I would say, because, for example, when boxing stopped because of the coronavirus, we were in the middle of our junior championships. So we had people who were in the finals, which has now been kind of rolled over to October. So you're expecting youngsters to not just stay motivated, but also to maintain their weight. And we know young people, some six weeks summer holiday, they come back and they're 7-8 kilos heavier than they were and 4 foot taller. So that'll be a particular challenge. And I know a number of young people who are still trying to train at home as if they were going to compete next week. And I think this is where they need that kind of tailored support, particularly from the coaches, to kind of say, you know, train today, have a rest day, and do things in moderation. There's no quick answer because I think at the grassroots sport, there just isn't that one-to-one support, and who could afford it. So it'll have to rely much more on the actual coaches from the clubs getting involved. But at elite level, I think again, while it's challenging, they'll have better access to that kind of support.
Yeah.
Just to add to that, I mean, I think an element of it's about expectations, and that some sports might look quite different when they return. So I suppose it's just trying to be realistic about what's feasible within that return, even at a really sort of basic sports like well, I won't say that now because it means that one, but there's I think there's an onus on those sports themselves to sort of be clear about what people can and can't do when the return expectations are sort of managed as well.
Yeah, that sort of answers the follow-up question. Actually, there was a follow-up question about how to, well, it kind of answers in a small part, how to cope with the anxiety of returning to physical interaction, which could be unsafe or uncertain, when Zoom might have been a bit easier from that respect. So how, well, I'll put this to you, Barry, as you were just touching on it. How would you support people to cope with the anxiety of returning to physical interaction?
Well, I don't know how equipped I am to answer that question, but I can certainly give an opinion on it. I think it certainly probably needs to be a sort of gradual thing, and also be clear on what the sort of expectations are, and from both the sort of the coaching side, or the governing body, whoever it is, and also the person sort of returning. But I suppose just in some way to sort of defend those providing sport and physical activity, that for them this is going to be really challenging in terms of sort of trying to comply with all the sort of guidance that will be issued around social distancing, equipment, all that sort of side of things. So I suppose we just have to be easy on each other to start with. I don't know if that's an answer, but it feels like it needs to be a gradual process.
Yeah, I think that's fair. Would Bevis, Carla, would you like to add anything to that?
Yeah, I think one of the things that will help reduce the anxiety somewhat is for the clubs, organisations to have kind of clear guidelines and clear measures. Because obviously some sports share equipment, and you know, in the old days it was the easiest thing to share stuff, whereas going forward that's very unlikely that will be the case, at least for a year, maybe longer. But if the club's going to have better guidelines and processes about how to, when they're going to clean kit, who cleans it, who can use it, I think it will help reduce some of the anxiety.
Yeah. Carla, would you like to add anything?
I think I absolutely agree with what Barry and Bevis have said. I think it is just depending on, especially if it's a contact sport, it's a bit more difficult. So for the likes of football and rugby, it's just making sure that their clubs have those procedures in place, and that you return when you feel comfortable. I'm sure that you've got your own community in your club or at the session that you go to. And if you have doubts for any reason, just hold it off for a couple of weeks and take it at your own pace, even if it is going to observe from the sidelines, just so you're part of that community, but you don't have to take part.
I think that's a really nice point to end on. Take part when you feel ready. Unfortunately, we do have to end though, because it is very nearly 3 o'clock. But I'd like to thank our incredible presenters, Carla, Bevis and Barry. It's been fantastic and really, really insightful. So really appreciate you giving up your time to do this. But also a massive thank you to everyone who joined us as well, and for all your questions. Sadly, we weren't able to get through all of the questions. So if you had any questions that weren't answered, or maybe you weren't comfortable asking them in this context, please do contact us directly by emailing events@londonsport.org. We will review them and we will come back to you personally. So please do that if you didn't feel we answered your questions. We're going to be hosting another webinar in 2 weeks' time. We've got lots of things we want to cover in these webinars, so we're finalising the topic now, and this will be confirmed in the coming days, and then registration will be available soon. And lastly, we'd really appreciate your feedback, so please do tell us what you thought by taking part in the Twitter poll. The link will be available in the chat. So yes, thank you again. Thank you very much, everybody, for being involved, and to our amazing speakers. Thank you so much.